Hi everybody, it's Dr. Mary Gardner and it is December 19th. I hope everybody's enjoying their holidays and the winter season. I just got back from speaking in San Diego at a conference and I'm excited to be home and spend time with my family for the holidays. But I wanted to talk today about a topic that actually is near and dear to my heart because my own pet actually had this disease. And what I'm going to talk about today on this live is laryngeal paralysis. And some of us might call it LARPAR for short, so you might hear that, or some other acronyms called GULP, which I'll explain in a little bit. But it's a disease that I didn't appreciate how bad it was until I started doing end-of-life care and how many older pets, particularly large breed dogs, that would have this disease. So I wanted to dedicate this Facebook Live to laryngeal paralysis because it is something that I think is almost like an unknown problem or just not as well-known problem that affects so many pets. So what LARPAR is basically typically a neurological disease. So first, let me explain a little anatomy, if you will, and it's about the larynx and the trachea. So as you know, your mouth receives food and air. And so basically, depending on whether it's food or air, it's going to go down the esophagus or your trachea, right? So, but how does it know which way to go? So we have to have some way to prevent food or water from going down our trachea when it really should go down our esophagus. So Mother Nature has created this wonderful thing where it's a little doorway or a little window, or curtains rather. And so there's cartilage that protects our trachea, and it's called the arytenoid cartilage. Sorry, it's a fancy word, arytenoid cartilage. And what it is it's kind of like, I think of it like curtains. And so it's the curtains that protect the trachea from anything but air going down. And so those curtains are closed. You like my green holiday nail polish. Excuse me for my green. But so those curtains are typically closed while we're eating or drinking. So that way it prevents anything from going down the wrong way. Right? And so that's why when you're eating and you happen to speak and you inhale wrong, you actually get food down your trachea and you start to cough, right? So that's why your parents always told you to like not talk while eating or eat with your mouth closed because you don't want food to go down your trachea. So what happens is when you're breathing, so when you're either intaking air or actually speaking or making sounds, that arytenoid cartilage or that curtain, if you will, needs to be pulled back so that way air can go down the correct tube. So there are muscles that attach to this cartilage that pull those curtains back, and so they make the opening for your airway. And so muscles are innervated by nerves, right? That's how our muscles work. So the nerve gets kicked off, gets fired off, and our muscles work. So if I want to make a bicep, there's actually a nerve that innervates my bicep that makes it move. So there are nerves that innervate the muscle that pulls back the cartilage, so that pulls back the curtain. So hopefully that little anatomy is helpful with now the conversation of this disease called laryngeal paralysis. And so what it basically is, there are many different reasons for the cause of this, but what happens is that for some reason that cartilage cannot be retracted, cannot be pulled back. And what typically is the cause is that those muscles that pull that cartilage back are not working properly. And so one of the major reasons is that the nerves that innervate that muscle that pulls it back is damaged, whether it's damaged from trauma or from it's what we call idiopathic, so we just don't know why it happens, but that nerve just stops working. And so when that nerve stops working, those muscles can't pull this cartilage back. And so we call this laryngeal paralysis. So the larynx basically is paralyzed because it can't move. So we see this typically in dogs, although cats do get it. We see it typically in larger breed dogs. So Labradors, Golden Retrievers, Dalmatians, the larger breed dogs are typically the ones that have this problem. But of course, I see it in small dogs. And with cats, there is no breed predilection for cats. So cats can get it, although dogs get it way more likely. And also interesting, about 3 times, I think it's 3 or 4 times more likely to happen in a male dog than a female dog. So male larger breed dogs are more prone to getting this disease. So now how do you know if your dog or maybe have some concerns about your dog having laryngeal paralysis? So in the early stages, when maybe the larynx cannot be pulled back as well, in the early stages, you might simply see just a voice change. So there might be a change in the dog's bark. I have a wonderful video. I think I could try to post it after this Facebook Live, but I've got a video of a dog that barks kind of croaky, if you will. So if you've got an older dog that's got this croaky bark, it's embarrassing if I try to do it, but no, that's not it. But if you can imagine a little croaky bark, it could be something to look into to see if it's LARPAR, because the vocal cords are back there as well, so that bark will change. We also may see some coughing or gagging while they're eating, because remember, the food is going down, and so things are not being directed properly. And so they may, as they're breathing in while they're eating, some things may go down the wrong pipe, if you will. So that's some early stages. And I think when I was in general practice, I never saw that many dogs with that stage. I really only saw them more as the disease progressed and then got to the severe stage. So from that mild stage of a voice change and some intermittent gagging while eating, it'll move to a more progressive problem where inspiratory stridor. So inspiratory stridor are fancy words for noise when a pet is breathing in. So when the dog is breathing in, it'll make kind of a flappy sound. Stridor is what we call it. And so it just doesn't sound right. We may see some increased breathing effort and also increased breathing amount of breaths, right? So imagine if you're short of breath and you can't get enough in, you might breathe more. So what might look as panting or just, increased breathing, but also just the effort in which your dog is breathing. So if it looks like they're, I don't want to say struggling, but it is more difficult for them to breathe, or they'll do something what I typically see is abdominal breathing. So they're using their ab muscles to actually push the air in because that the curtain's closed, right? So they can't get air in, so that they need more effort to help suck that air in. So we'll see that progress. And then the severe cases is we'll see actually respiratory distress and severe panting. So, really bad respiratory distress. Like that. And what then happens is that the larynx will start to get edema because it's getting it's just getting almost traumatized, and so then it will start to swell, and then we've got this whole big problem happening. So if your dog collapses and has this increased breathing, along with this voice changes, things like that, these are signs of laryngeal paralysis. And when it gets severe, it's an absolute emergency to be not to be taken lightly. So basically take them straight to the emergency room if they're actually collapsing and having difficulty breathing, because that is the severe case. And that's unfortunately what I saw more often in general practice, is on emergency, where they would come where a dog would come in that respiratory distress phase, and it's really sad, and it's scary for everybody, scary for the pet, scary for the owners, and scary for the whole staff. And so we have to act fast, give oxygen, give some drugs to reduce that swelling, and also calm the pet down, because when you can't breathe, imagine when you're hyperventilating, and so that's what it feels like. So it's a very scary situation when it gets that far, but I hope that we can catch it a little bit earlier. So laryngeal paralysis is something that we also see in our older pets more often. So dogs that are over 7 years old, if you start hearing your dog have that bark change, it's absolutely something that you should be considering and talking to your veterinarian about. And there's something called the gulp. Remember I said I'd get back to this, and the gulp is GOLPP, and that is geriatric onset geriatric onset laryngeal paralysis and polyneuropathy. Big words to basically say, as a pet gets older, that this disease can happen, and it affects the nerves that pull the curtain back. But polyneuropathy, that last word, basically means that it's going to affect other muscles. And so what I'll see in these dogs that have gulp is that they will also have muscle weakness throughout their body, particularly when they're walking or standing up. And so it's usually I'll see muscle wasting, so like their glutes, so their butt muscles, if you will. You'll start to see them get a little bit skinnier. Their leg muscles just don't look as beefy as they used to be, and the pet is just weak. You'll also see the toe dragging. So I talked about mobility issues in dogs a couple of videos ago, and this is one of the things I think of when I see a toe dragging dog. So if they scrape their toes, and if I see also just uniform muscle weakness throughout the pet, I start to think about laryngeal paralysis. So if we can catch this earlier on, it would be so much more helpful, because there are things that we can do. When they get to that severe stage, it's not good. So either we have to, like I said, put them in oxygen and help them with medicine to get over that hump, but it may happen again. So there are surgical options and then just non-surgical options. So I'm going to actually start with what I would suggest, and that is the surgical option. So let me talk about why this means so much to me, and that is because of my boy Duncan. So if you remember from a couple of live videos ago, my big boy, my big love Doberman, he had heart problems, but he also had laryngeal paralysis. And so what happened was, maybe 3 years ago, when he was around 11, he started to cough. But it was just a weird clearing of his throat cough, and I thought that was strange. And so I thought, because Dobermans usually get heart disease, I thought, this is the beginning stages of his heart disease. So I brought him to the cardiologist, because I am not shy, and I will take them to the best. So I took him to a cardiologist, and they did a whole workup and said his heart is beautiful, which of course it was, because he was perfect. But I'm like, but he's making this weird coughing sound. And what it was early stages of laryngeal paralysis. And so as the months went by, his breathing started to get increased effort. So I started to see that belly breathing. And what really made me nervous was when I saw him do that abdominal or that belly breathing while he was resting. And so if your pet, while they're laying down what should be normal resting, whether it's sleeping or just, lying around while you're watching TV, and if you see increased breathing effort at that point, that's not good. And so I knew that I had to make a decision. So either I had to just deal with some of those side effects, and when it got so bad where he went into respiratory distress, be ready to say goodbye, or actually go for the surgical route. So Duncan was about 11. He had no other problems. Blood work was perfect. His heart was perfect, like I said. But he's an older guy, so he's 11 years old. And I got to tell you, I had a lot of friends that were like, that's an 11-year-old Doberman that may make it to 12 if you're lucky, and I wouldn't do it. So my internal dilemma was, but what if I can get him to 12, and I can get him to 12 well? What if I get him to 13? And what if I could just have a few extra good months with him? So I was willing to risk the side effects of surgery, because I think they were less side effects than letting him manage this disease without surgery. So I would always suggest surgery for these older dogs that have nothing else wrong with them, because I think it's a really good option. So what they do for the surgery, they call it a tieback. A general veterinarian usually does not do these surgeries. It's usually an actual boarded surgeon that does it, because it's a little bit difficult, but it's actually easy. So what I mean by that is, what they do is they do a tieback. So they tie this curtain back. They usually just tie one side. So they'll do an exam of the larynx, and usually like one pulls back more than the other. So the one that's the worst side, they'll usually pull that back. So what they do is they pull it back and they tie it. So if you've got curtains in your house and you've got those tie backs to hold the curtain back, that's what it is. So they'll tie it back. And so it's done through the outside of the neck. They'll go in. So that's what I mean by it's not that scary. It's a difficult, challenging surgery, but not so much difficult for the pet afterwards. Care for the pet afterwards is not that bad. So what you have to be worried about is, imagine now you've got your larynx, so you've got your curtains, and one of the curtains is pulled back. So what happens when you're eating? You could aspirate that food or water. So that is one of the worst things that could happen after the surgery. So now my boy Duncan, he was not a good eater. So he was a good eater, but he was a really bad drinker. So he would stuff his nose in the water bowl, like literally put his nose in it and suck up all his water. And so I was really worried about him aspirating water. But you know what? That was a risk I was going to take, because the alternative was for me to say goodbye to him. And so I was like, you know what? I'm gonna try this. So he actually did really well. I got some food bowls and water bowls that slowed him down, that made sure he couldn't stick his schnoz in the water bowl. So it slowed him down, but eventually he kind of learned on his own, so he could drink out of regular water bowls, and he learned how to just manage himself. Did he cough occasionally and get some water down there? Sure, but not actually that bad. And he did really well. His recovery was like a champ. So I am so glad that I did that. And he did not die because of laryngeal paralysis. He died because of heart failure. Now, which is a totally separate disease, but not for another 2.5 years later. So I had a wonderful 2.5 years, and I would not have had that if I didn't do the tieback. But what also happened later on, about 1.5 years later, is that polyneuropathy that I talked about started to get a hold of him. So he started to have the toe dragging. He started to get weak. I could see that his muscle condition started to decrease, and he got a little bit spaghetti leggy on me. And so then I went to halters and some other things that help him manage his polyneuropathy. As well as acupuncture. I got a wonderful veterinary acupuncturist, which was really helpful to manage his progression. So I believe that if you can financially afford it, and your pet is able to or does not have any other major problems, that I would always go for a tieback. And maybe that's just my personal preference because I had a good experience, but a lot of my clients that did a tieback also had good experiences from it. So I don't want you to be scared about trying it. Now, the non-medical options that you can do, there are some medications that we're trying to help kind of keep those nerves working well, but they're not proven yet. But it's worth a shot, and they're not very expensive, and your veterinarian can talk about it. Some other things are keeping them not stressed. So remember when I talked about the edema that could happen when they have that breathing issue. So we want to make sure, sorry, I'm going to read this comment because I love it. Eva said, surgery provider lab enjoyment in life again. It's been 1 year since surgery and he's doing well. This is awesome, Eva, and thank you so much for sharing your story, because I hope you could share a picture because so many people are scared of doing the surgery. It sounds so crazy, and especially because they're usually older dogs, but I say go for it. If you can do it, 100%, because there really is, I mean, I don't want to call that a cure because it is a cure, but it does have some problems. However, there is no non-surgical cure, and it's just managing their world. And so we have to keep them cool because they could overheat. No running with them. Don't have a collar. You should move to a harness. And also, I know I talked about that the disease could happen just for no other reason, but it also could be trauma. So I've seen it with if they've gotten, in a car accident or something like that where they've had trauma to their neck. I've also seen it. So we want to reduce any problems around their neck. So using a harness, walking them only in the cool time. So I'm in South Florida. I don't know when that is because it's always hot and humid here, but keeping them in the air conditioning, keeping them calm, and making sure that you know what the emergency signs are. So again, there is sadly no cure for it. It's just watching them and keeping them safe. And also keeping their muscle atrophy at bay. So making sure that they're exercising and bringing them for walks when it is cool, because we don't want them just to stay in the house and not do anything. So I wanted to dedicate this Facebook Live to something that could have been really scary in my world with laryngeal paralysis for Duncan, but it actually turned out really, really well. And I'm so glad that I did it. But the sad thing is I see it so often with our patients. Now, typically at LARPAR Love, we're helping families in the very end with hospice and euthanasia. And when I go to a home and I hear that dog have that croaky bark, and they think, you know, we have an 11-year-old Great Dane. She has a heart murmur. I'll have to read that full comment. I can't see it right now, but I'll hope to give you some advice on there. I lost my train of thought, but anyway, so when I go to homes and help a family say goodbye to their pet, and I see them, you know, panting and have that croaky voice, I would be, you know, thinking about that LARPAR. So Cristiano says it's been 1 year and he's doing fine in his regime. So again, I'll read your full comment after this. So we're going to post some stuff we have on our website on laryngeal paralysis. There's a lot of good information online, and your veterinarian can give you a lot of education as well. So I really want you guys, when you have an older dog, again, this can happen in kitty cats too, but if you have a larger breed dog and you hear that there's a change in his voice, do not just think he's an old boy getting old. There's actually a problem going on. And so there's other causes for a voice change, but this is the one that I see so often. And we do see it again, like I said, in older male dogs that are of the larger breed. So my boy was a Doberman. He's a big guy. And so that was something that he struggled with. So I hope this was helpful. Thank you for those that posted comments. I'll read some more as we go throughout the week, and we're going to post some information and some pictures. And also, don't be shy and suggest some topics you would like me to talk about. So I know that I've got a topic next month. I can't remember what it is, but if you've got any suggestions, certainly post it out here and be on the lookout for the next Facebook Live. And so everyone be well and have good holidays and take care.